The UK has passed 100,000 COVID deaths. Globally, over 2 million people have died. And the pressure from COVID-19 is unrelenting.
We know about a variant that's emerged in South Africa, several variants that have emerged in Brazil, a variant that is reported from Southern California, as well as the variant reported in UK, and one that was found in Denmark associated with mink farming. And there will be more.
These variants are driving infection rates, and there's this warning on the one identified in the UK.
There is a realistic possibility that this variant may be associated with increased mortality compared to the old variant, as well as increased transmission.
Faced with all these new variants, many countries are focused on travel.
With the pandemic worsening and more contagious variants spreading, this isn't the time to be lifting restrictions on international travel.
More than that, the US ban on arrivals now extends to Europe, South Africa and elsewhere. Then there's Israel. Its government says it's hermetically sealed the skies. And the UK, which already had a travel ban on some countries, has now added this dimension for UK citizens.
We will require all such arrivals who cannot be refused entry to isolate in government-provided accommodation, such as hotels, for 10 days without exception. They will be met at the airport and transported directly into quarantine.
But are travel restrictions the answer? Can we be sure they'll help rein in a rampant virus, and at what cost? Not everyone's convinced. This South African scientist describes travel bans as
almost like silly. This trying to block a country because we know how fast this virus spreads.
The view that these bans are silly, that they can't stop this kind of virus, fits with what one American epidemiologist calls a long-time scepticism of travel bans amongst public health experts. But Dr. Jared Byton wants scientists to revisit the issue, arguing that travel is the hallmark of the spread of this virus around the world. And how we understand this doesn't just matter in terms of people's health, it matters because travel is central to the global economy, because of the social consequences of keeping people apart, and because trust in our governments is at stake. When life's disrupted to this extent, we want to know if it's for good reason. I'm going to look at all of that. But let's start with the restrictions that are in place. Countries have adopted a range of different approaches, including a complete ban on arrivals, restricting arrivals from hotspots, mandatory quarantine, and showing a negative test before travel. In the UK's case, its goal is clear.
To reduce passenger flow, so that only a small number of people for whom it is absolutely essential to travel are doing so.
Right now, reducing passenger flow is a global goal, and it's happening. Airline passengers fell by 67% from 2019 to 2020. And for some places, none of this is new. Australia and New Zealand, Taiwan, Vietnam, Singapore, all have had tight travel restrictions for months, and all have had success in controlling COVID, which adds to the case for closing borders. It's a case with considerable support. This is a neuroscientist in Ireland.
Lockdowns only bring the case numbers down in the community, but they don't keep the virus out. It is essential that we keep the virus from reseeding the country. Otherwise, we're making a mockery out of everything that we're doing as citizens in enduring lockdowns.
That's backed up by Germany's leading coronavirus expert, who argues the more vigorously the brakes are put on the spread of the coronavirus in the country, the more important it is to look at what's being introduced from outside. Indeed, Germany's now banning most travellers from the countries hardest hit by these COVID variants. And on the face of it, there's a logic to all of this. Stop the spread of the virus and its variants by controlling the movement of people between countries. An international lockdown, if you like. But if that's the case for doing this, questions remain. Not least, is travel the problem? Let's take the UK as an example. COVID-19 was brought into the UK on at least 1,300 occasions by the end of March. Initially, travel certainly was a factor. Fast forward to December, there's a different story. The government's Transport Secretary says 1 in 1,000 cases in England was brought in from abroad in December. In that same month, 1.1 million people went through Heathrow Airport alone. As Grant Shapps told the BBC, in terms of proportion of the total, it's small. In other words, with the virus moving freely within communities, community transmission is the major driver of infections, not international travel. And that's why the travel industry is pushing back. On the quarantine measures, the Airport Operators Association says it remains unclear what additional public health benefit mandatory hotel quarantine would have. And this is the World Travel and Tourism Council.
We believe there are more effective measures of curbing the spread of the virus without having to completely halt international travel and closing borders.
By that they mean things like passenger testing, proof of vaccine, social distancing at airports and so on. But the variants have made this calculation more complex. Travel bans are not only about containing COVID-19, they're about containing particular types of COVID-19. And if you want to stop something arriving at all, well, Australia is an important case study. And this is the Australian experience. Since early last year, foreigners haven't been allowed in, Australians coming home have to hotel quarantine, and there's a cap on how many people can arrive each week. That's led to what 7 News Australia describes as stranded Aussies forced into Hunger Games-type battle to secure plane tickets home. And we know many still haven't got home. But public opinion is behind the policy. Case numbers and COVID deaths are very low by international standards. And look at this. It's Christmas in Sydney. Life isn't normal, but it's a lot closer to normal than in many places. There is, though, a crucial difference here. Australia's policy is one of eradication. It wants to completely control and eliminate the virus. That can work, but it's not an option for many countries where the virus is established, which is why you can't assess this subject without talking about the timing and asking, is it too late for travel restrictions? The travel journalist Simon Calder sums up why some people think it is.
Medical people here in the UK, at least, have always said that the time to introduce really tough travel measures is when rates of infection are extremely low. And at the moment in the UK, they're extremely high.
There's also this story in the British scientific journal Nature. It looked at the data around border closures and concluded models estimate that travel restrictions worked early in the pandemic but became less effective throughout the year. The point here, though, is the UK and many other countries aren't only looking to restrict the virus. This is about trying to restrict certain variants of it. But even on that point, there are doubts. This public health expert is blunt. It won't be effective because people will just connect in other countries to avoid quarantine, she says. Others argue the virus is just too virulent to be contained in this way anyhow. So where does all of this leave us? I find it useful to think about how we define success, because governments are simultaneously working towards many different goals during this pandemic. In the short term, governments urgently need to suppress the infection rate. Travel restrictions may help that by containing the new variants, though they're only one of several factors. What we can be more certain of is that they will carry a human cost. This is one Australian who's been diagnosed with cancer but can't return.
We just want to get home to our family. When you go through something like this, you need the support of your family.
There will, of course, be major economic costs too. Governments don't deny this, but argue at this moment the cost of not acting on travel will be greater. And if that's for now, what of the long-term goal here, of moving beyond a life shaped by COVID? As the WHO's Dr. Tedros puts it,
no one is safe until everyone is safe.
His point being the resolution of a pandemic requires, by its very nature, a global solution, not national solutions. At some point, countries will have to reconnect. We'll reconnect. The restrictions will go. For now, though, they remain. A reminder of this virus's power to alter how we live and how we move.